Alright, so next is the the limb development. And this is how I look like when we're a baby. Just kidding, this is not how I look like, this is just a sketch to explain things better. So first things first, we need to know which position the limb bones will develop from and which turn into upper and lower limbs. So right here, to know position of the limb bones, we need the Hox gene for position. Then the TBX4 and TBX5 gene will tell us whether it's upper or lower limb that is developing in that place. Then also we have the fibroblast growth factor. What that do is to stimulate the development of the apical ectodermal ridge, or AER. This AER will also produce fibroblast growth factor 4 and 8. Now, what this 4 and 8 does is to tell this mesoderm to proliferate into a limb bones. So we have it proliferating here. Now, close to the AER, we have the progress zone. So what happens here is they keep proliferating with no time to differentiate. So the ones behind the progress zone will begin to differentiate, first of all, into chondrocytes and then bone. So we have your humerus here, or your femur, whatever you want to call it. So we have it here, or it developing into chondrocytes and eventually develop into bone. We have your progress zone. Proliferation cycle occurs, the AER is producing fibroblast growth factors 4 and 8. Eventually, we have the humerus or femur and your ulnar radius, or your tibia and fibula. I also have a progress zone, constantly proliferating. Now, in early life, it is called stylopod and zygopod, not femur or anything like that. Then what happens in this place? We have increased amount of bone folding protein, increased amount of retinic acid, which causes the apoptosis in the AER, forming what looks like fingers. That's what's happening here. And eventually, this AER dies off. Therefore, there is reduced fibroblast growth factor, so no more proliferation. The bones can now, or the mesoderm cannot differentiate. So you now have your stylopod, your zygopod, and your orthopods. And eventually, we've got this. Okay, so we are here. What's happening here? Anyway, just imagine these fingers are all identical, look alike. And the body doesn't know who should be the pinky, who should be the thumb. And that's where this thing comes in place. It's called the zone of polarization. It creates a grid of growth factors that will determine which one will be the pinky and which one will be the thumb. And also, we need to decide which part will be the dorsal or the plantar surface of the palmar surface of the palm, or the hand, or the lower limb, anyone. So, to determine that, the dorsal ectoderm will produce the Wnt7a gene, which will stimulate the LMX1 and then stimulate the production of things that identifies the dorsal aspect of the hand or the feet, which is the nails. Then for the ventral ectoderm, we have the engrade1 gene, which stimulates the ventral parts, which is mainly the fingerprints, and that's the body can differentiate which is which. And then you have something like this.